guys, it's Professor Courtney. I'm going to go through your steps of your catheter, urinary catheter insertion and removal. Now remember, we're going to be doing this on both males and females, so be expected to do both. You're not going to know which one you're checking off on until you get into the class. All right, so you're going to do everything that you normally would do for any other patient. So knock on the door. Hi, I'm Teddy. I'm going to be your nurse today. I have orders to put in a catheter for you. Is that okay? Sure. All right, can I get your name and your birthday? Bob Smith, 1272. Okay, looks like we have the right person. All right, well, I'm gonna wash my hands real quick. Wash your hands. All right, so first thing I wanna do is make sure that the bed is a good height. I'm pretty short. It should be right around waist level, so whatever's comfortable for you. And if you need to, you can move the handrail up or down. I'm actually okay with it up, just whatever's comfortable for you. Next thing you want to do is make sure that you have privacy, so I would close the curtains at this time. I'm going to leave them open just so that you can see what I'm doing here, but remain privacy. I've washed my hands, I've checked my patient, I have all my equipment in the room. If you were removing one and then putting it in, you would need a 10 cc syringe, so just know if they have one or not. This patient actually doesn't right now. And then we are actually going to leave a straight Foley catheter, not a straight catheter. I will show you one here in just a little bit. Do you have one? I hope. We'll show you the differences between leaving it in an indwelling catheter and a straight catheter, which would be just to put it in, get what you need, and take it out. The big difference between that one and what I'm using now is this one does not have a balloon that you blow up. Now, old practice, and you may still see this in some facilities, it's pretty much gone away. We do not pre-inflate the balloon. So just remember that if you see somebody do that, super old practice, we don't do that. All right, so I have privacy. I'm ready. Are you ready to begin? Yes, he's ready. She's ready. Whoever it is, I'm gonna figure out here in a second. All right, so we have privacy. Next is positioning. I would say of all the catheters that I've ever put in, if you're having trouble with it, probably it's because you're not comfortable or your patient's not comfortable. They're a little bit easier in the emergency room where I work because we can Trendelenburg a little bit easier and it kind of makes everything go up. Depending on the floor you're at, some floors allow it, some floors don't, so just kind of know what the policy is of your floor. All right, so I think I'm comfortable here. Lift up. Okay, you're gonna see me look. I don't have gloves right now, but you would see me having gloves on. All right, I'm going to position you. At this time, I would kind of look at your patient, see what you kind of have going on here. Do they need some peri-care? If so, we'll go ahead and wipe up with a wash rag, make sure we're kind of clean. And then you can, with your dirty gloves on, or clean gloves, not sterile, go ahead and take a peek, see what you have there, make sure that you can identify easily before you get started. Okay, everything looks good to me. Now, if you want to use a table, that is fine as well. Remember, I'm an ER nurse. We don't really have tables, so get used to whatever you have available is what you're going to use. All right, so for purposes of this, I'm going to go ahead and demonstrate on the table. Maybe. There we go. All right, so just like our catheter or kits that we used yesterday, there is a perforation on this, so don't be trying to rip it open because then you're going to touch something that you shouldn't be touching. So find the perforation, it's up at the top, and it should rip pretty easy. Now, depending on what you're using, you can either use a trash can such as this, it might make it easier, or some of the kits, actually, you can use this as a bag as well, whatever's comfortable for you. Just remember with your sterile field, what is considered sterile, what's not. Now, just like in the other kits that we use with the wound care, it's got the little lip here, so remember which way that opens. So out and away, you should not be going over your kit, but kind of make it comfortable for you. There's really no super right or wrong way as long as you are remaining sterile. So remember, it's the 1 inch around and it's above my waist. Now in this one, your gloves are in. Some of the kits come with gloves, some don't. So if you don't like these, actually don't end up liking these in hospital setting. And you'll see the differences with the white ones versus these green ones. It's just whatever comfortable. I'll go ahead and use these today. Now there are multiple different ways of using this as well. I'm gonna go ahead and touch it. If you want to use this as sterile, it would remain in the kit and you would touch it after you use your gloves. Now I want you to be aware of having to do it both ways. So for me, an ER nurse, I don't use this as sterile. I'll just put it down just in case, like if the patient made a mess on the bed, I don't want to change the whole bed. You should know how to use this sterile as well. Remember, it's the, let's see if we can get close, it's this shiny part that goes down. If some liquid got on that and the shiny part was up, the liquid would go off of the bed. So we want the absorbent part up to the patient. All right, so I'll show you how to do it sterile as well. Now you will be checking off on your sterile gloving as well. Remember, I told you the most common thing that I see is not opening the package all the way, so make sure that you're comfortable with that. Can you do it on the bed? Yeah, you can do it over here if you want, but if your patient's like moving around like all ER patients do, then you want to also be able to have a different place that you'll be able to open it up and not contaminate. So you will be doing gloving as well, which I just remembered. I'm not wearing a mask today. You will be wearing a mask. I'm doing it so that you can read my lips while I'm talking. All right, so open it all the way up. Remember, this does not go like this. That's contaminated. So if you wanted to do it like this or kind of like that, that's okay. Just this is not okay. All right, so open. I'm right-handed. If you want to zoom in a little bit. Remember, you can touch anywhere on the inside of the cuff, not on this side, with my non-dominant hand. So I'm on this way. I can identify where the thumb hole is. It will also tell you on your paper, thumb on right on most of them. So identify where the thumb is. And then you got to be a little bit aggressive with it. If you just kind of go like that, and let's say you messed up at that point, that's okay. Leave it there because now I have fingers that are okay, and I can use it that way. I'm actually okay though, so I can pull all the way up. Now, this part is still unsterile, and this part here is sterile, so I can touch on this side. Now remember, 2 fingers. You can use your thumb right here, but then when you get ready to go to your hand, I say always put your thumb up. That way that you're not trying to touch on the unsterile once you put your hand in. So thumb up, identify the thumb, and if you were to mess up right here, what would you do? You would stop. Okay, well this is sterile, so then I can mess with it up here. That's okay as well. Another common thing that I see is that you're going to be sweating quite a bit. So see what I did, and I just went over my watch. I would make sure that you take anything on your wrists off before you start until you get comfortable with it and that you're able to kind of manipulate over. Just go ahead and take any rings or watches, anything that it can get stuck on. And also know you're probably going to have sweaty palms as well, so that they'll kind of get stuck. But as long as you have the sterile part, sterile to sterile, you'll be okay. All right, so I'm sterile. If your patient was able to lift their hiney, which this female is not able to because it's a dummy, you could go ahead and pull this up. Remember, the shiny side is going to go down. Now, OB nurses are really, really good at this. I'm an ER nurse. I ain't so good at it because I don't use it sterile. But you can kind of pinch on the inside, have the patient lift their hiney, and then as they lift, this would go under. So you're probably going to have a partner at this point say, lift, then lift. If not, you can do what I do, but now you want to watch and make sure that you're not doing this because then you're contaminated. So in checkoff, if you did that, say, oops, I just contaminated myself. I need to switch my gloves. At that point, we'd have you switch and then you would keep going. And that's exactly what you would do in a real life situation. So just be aware if you're touching anything because you're sterile. So if you didn't want to use it as that and you just wanted to lay it under your patient, you would just put it here, making sure that you're not touching anything. And this would be considered sterile at this point. Again, if you were in real life situation and you decided not to use that as sterile, that's okay too. Knock that off. I can touch anything that I want in here because I'm still sterile. And this little doodad, so I can get him open. Same thing. This you can use for, do I have a penis somewhere in here? No. We'll find a penis here in a minute. You can put it around. A lot of nurses decide not to use this just because it's mostly used for males. You can use it for a female, so it's whatever you want to do. If I'm using it for a sterile field, yes, you can go ahead and use it as well. I say while you're practicing, go ahead and use it. That way that you can kind of get used to what it is. So if I had a male, it would go here, go around, and then when you're done, it'd be a quick little rip. So we'll use it for right now just for practice purposes. The rest of what is in your kit, you're going to have some, this would be iodine actually in the hospital today. They are alcohol swabs. You can use this on the mannequin? Yes, you can use these on the mannequin. If you had some that were iodine, which we used to get them in the kits, we could not use it on these guys, so because these are alcohol, we're okay using them. The next thing that you have in here is some lubricant, and that is to help it to insert as well. I'll show you a little trick with that. And then you have some sterile water to inflate the balloon. Let me show you the balloon real quick. All right, so this is the actual catheter that is going to go in your patient. It has this little cover that goes on it. This would be trash when you're done, but just remember that this little guy, he's going to wag around, and if you accidentally touch something, then you've contaminated everything. So just make sure you kind of keep your hand on it. Okay, so then you have these 2 little guys over here. This one over here, these are a little bit different because they're practice. If you wanted to get a sample, you would come out of here. If you wanted to, I'm going to go ahead and pre-inflate. In the hospital, most of the time these things are red. Red means stop, don't open it. You can open this, but once you've opened this, you've opened the system. That's what they call it. We would do that if we needed to change the size of the catheter, or maybe you needed to use a 3-way, or you needed to flush it. There are multiple different reasons, but just know once you open this tape, then you've opened the system. So I will inflate the balloon just so that you can see it there. And that's what happens within the urethra that keeps it from pulling out. So you would go in, you have your hole here, and then he can't come out, and he gets stuck. We don't do this prior to insertion because now you've increased the chances of getting bacteria on this, and it's super out of practice. I believe I was a nursing student whenever they changed that. Okay, so that's what that little balloon looks like. Usually somewhere on it, it'll tell you how much. Most of the time it's 7 to 10. We'll just go ahead and put all of it that will fit in these guys. So before you start, you can go ahead and hook up. So go ahead and hook up, but don't pre-inflate. Your next part that you will want to do is get this lubricated. There are multiple different ways. When I was a new grad in the emergency room, the best Foley person that I had actually taught me this. If you pull it out and you stick it in here, then you don't have to worry about it moving around. Other thing that you can do is you can squirt this out inside. Cat, mouse, whatever you want to do. It doesn't really matter as long as this guy is safe and he's not moving around. So I have him here. I'm ready to get started setting up. I have both of my hands clean. Now, depending on if you're right-handed or left-handed, depends on what side of the bed you are on. I am right-handed, so I am on the right side. That way that I can hold with my left and clean with my right. All right, so go ahead and open this up. In the hospital setting, these are a little bit different. Depends on what you are inserting and what equipment, so just get used to what you have. Where I work, we have both these, and then we have the trauma ones, which you actually have to pour in, and these guys are actually in. So it's the same thing, just know what you have, because once you've touched, it's gonna be super hard to open this one-handed, impossible. So you have 3 little swabs here. So in your videos, it shows you how to correctly do this. So for a female, we would spread the labia. You have 3 there. So it would be one side. Now, do I put this back in here? No, I've seen many students do that. So it'd be 1. Now for me, when I'm in the emergency room and I'm doing really quick, I lay them here, that way that I can count. You can also put it in the trash. Just remember, you would not do this over your sterile field. It does not go like that. So wherever you want to put it, so 1, down, 2, down, the most important one, right down the middle, 3, down. Now I want to grab the end. Now a lot of times if you grab it like this, see how hard that is to control? Or if you put way too much lube, now your may actually be wet down here. That can also be hard as well. So for me in the emergency room, I pick up this entire thing because it doesn't really matter from this part down if that is sterile or not. So I go right up on top. Other ways that I've seen other nurses do it is that they will pick up the entire box and put it in front of your patient. You have to kind of use your 2 cents, use your critical thinking of what is best for your patient. So you spread, locate the hole, go in. You will get a little bit of a return. So sometimes on these guys, if they don't get it, sometimes I will be up here and I will push like that. Just give them a little bit of up. You'll go 2 to 3 inches more than when you get your little bit of a, I call a flash. And then insert. Should be the whole thing. Now that reminds me, you should be holding this down because if you don't, this guy can come open, and then you will end up spraying your patient with saline. So kind of hold on to that. It's like a positive pressure, and so then when you're ready to let go, if I was to do this, a lot of them are going to start backfilling like that. See how it's doing it automatically? And then you'll be like, what is that doing? So it's a positive pressure. As you're holding it, then release. Okay, and then you can pull down. It'll kind of get stuck there. Make sure that you have a return. When you're done, this guy can open this up. Clean it if you need to a little bit. This is trash. Unless you needed a sample, for this guy we will need a sample. I'll show you how to get those here in just a second. This would tape to one side or the other, so I would secure it here. This guy here also secures to the bed so that it's not pulling. The little holders here. Go to the side of the bed. If you want to come on this side, we'll show where to put that. There are multiple different ways. You just have to locate where on the bed. This would not be a good spot, because what would happen to this if somebody was put up or down? It would yank on it, right? So that's what these guys are meant for. All the beds are just a little bit different, so you just identify where on the bed that you would hang that. Some of them are more up here, some of them are down here, just as long as it's a non-movable spot. Multiple places that you could get a sample where you're going to be tested on that. So all of these are just a little bit different, so just make sure that you read on the bag or read on the instructions how to get them open and get a sample. So number one spot that you could get a sample the first time would be from this, because if this was let's just say you had urine on this and it was more than like 3 or 4 hours and it's been sitting there brewing bacteria, then this is considered contaminated. So the first time is okay, and it tells you how to open. So down here, I'd be able to get my sample down here. Open the system if you can see that, get your sample, and close. Another place that you could get it is up here. So it's got the one that you put the saline in for the bulb, and then it's got the second spot here. So you go in, get your sample, put down. For this one, you want a fresh sample, you would find some way of clamping this. Sometimes we use rubber bands. I've used hemostats. You have to be careful doing that as well. But that way that you have a good fresh sample. That's the most common. The third and last way that you could get it, if you could not do it this way, is to open the system and pour it out that way if you needed to. All right. This is where you're going to put it. Remember, this is sterile, so when you go to open it, the inside you would not touch in. Label this with your patient's information, your name, all the documentation. You've already taped this down. You've already secured it. Make sure your patient's comfortable. You would clean up as needed, and this would go in the trash. Did I forget anything? We're good. Okay, next part of your checkoffs is going to be removal. You also have to remove this, so same thing. Use the same paper. You'd have a towel or something available. You say, okay, we have orders to remove their Foley. Do you have any questions? Name, date, birthday, all those things that we already went through. Make sure you have your towel. You would have what we just talked about earlier, having a 10 cc syringe. Same thing, you put it on. Now the way I was taught is that you give a little bit of a pull and then let it do it itself. It kind of helps to not make you have muscle spasms. Let it fill up. Get a little pull if you need to. Purpose of time, I'll go ahead and do it. Okay, and then when you go to remove, remember you want to document how much your patient had, especially if there's on eyes and nose, how much they have in their Foley. Document anything that you see if they have like a rash or any signs or symptoms of infection. You want to tell your patient, okay, you're going to feel me pull. Don't bear down. You can take a deep breath, but don't squeeze, because if you squeeze, it's going to get stuck. So just wiggle your toes is what I like to tell them. When you go to pull out, remember to go out and kind of up, because this is probably going to have fluid on it, and you don't want it on you, don't want it on your patient. All right, you ready? 1, 2, 3, pull. And up. I get this, kind of go around, let it drain down. And then you don't want to go in the hallway carrying this. So it goes in the trash can, and the trash goes out to the biohazard. Okay, so that should be it on that. Remember, you're checking off on your gloves, male and female, insertion and removal, where to get your samples. Now let me find the male part.